Hi friends, welcome to Charcos. I'm Dr. Seema Balian, the founder and director of Charcos. Charcos is a healthcare recruitment and training company with over 15 years of experience in providing turnkey solution for training and recruitment needs for the nurses, doctors, and AHPs such as radiographers, occupational therapists, ODPs, and many more. OSCE training for all fields of nursing such as adult nursing, mental health nursing, pediatric nurses, midwifery, and learning disabilities. OSCE training is available in India as well as in UK. Orientation for life in UK, OSCE exam bookings and the logistics bookings, excellent pastoral care. Our state-of-the-art learning platform includes reading materials, videos, quiz to enhance your learning and equip you for a positive and a better outcome. For more information, please visit our website www.charcosglobal.com. Our Facebook page, Instagram, and LinkedIn pages by the name of Charcos Global, and subscribe our YouTube channel. Press the bell icon for regular updates and all the information that you require. We are looking forward to seeing you on our site and being a partner in your enhanced journey. Thank you very much.
Okay, so can you see my screen?
Yes, please. Midwifery, NMC OSCE postnatal care and postnatal checks.
Yeah, so as we had been discussing that there are in total 10 skills which are there. And so we have discussed till now, we have already covered the 4 birthing ones, which is a normal birth scenario 1, which was shoulder dystocia, birth scenario 2, which was the PPH, and the complex birth. So these 4 we have covered. And today we are going to be covering 3 more, which are like the postnatal care, postnatal check, and the systemic examination of newborn. So in today's session, we are going to be doing these 3, and then tomorrow we'll do the rest of them. So that way we are going to cover all of the 10 scenarios. So although it is sounds quite similar, the postnatal care and postnatal check, difference in both of them. So we are going to take them one by one. So first we are going to go through the postnatal care. Yeah.
Okay.
Yeah. So if we have to define that, what is the when do we call that as a postnatal period, or till when does the postnatal period stays? So normally we would say that it is the first 6 to 8 weeks after the birth. Although sometime it can extend up to like 12 weeks as well, but usually it is the first 6 to 8 weeks, and that is where we are more concerned about the postnatal care and postnatal checks and all that sort of things, because if there was anything were to happen, usually in this much time frame will happen, and if any action needs to be taken, we would have already taken the actions by that time, and after that it is like just carry as normal. Yeah.
Okay.
So the ethos of the postnatal care that what we are giving, basically it is a continuation of the care which we have anyway given her in the antenatal period, in the labor sort of period, and a little bit of the care after the her delivery as well, so that we make sure that she is absolutely 100% fit and fine after this whole episode of the pregnancy. And now, obviously, the baby, the mother and the baby, they can just carry on with a normal life, and all their individual needs and preferences related to the pregnancy are met. Yeah? And also, we want to make sure that they are having a supportive environment, because after the delivery, there is a lot of help and support will be required by the mother. And she will also need to know how to care for the baby, for themselves. And there are going to be lots of changes in the life as well. So lots of support is going to be required. And it's quite an emotional sort of thing which happens. That's the reason that she will not be only be need the support from the physical aspects, but there is a lot of support that will be required from that emotional and psychological side as well. Yeah, so that's why the postnatal care is extremely important. Okay, so you normally, and I don't know that has your experience been, but normally in UK there are various kind of discharges that can take place. So if everything is fine, if there is a normal delivery, the mother and the baby are happy and healthy after the delivery, there was no complication during the delivery, there is good support which is available with the mother, then you can be discharged as quickly as 6 hours after the birth. And the care can be given to the community midwife team, who can then support the mother at the home. But otherwise, depending upon if there was any complication, if there was any other issues, the discharge can be delayed. And normally, like if it is a cesarean section or thing, then normally it will take around the third day or so that you will be discharging, but that is after the cesarean section. So, are you also aware of the 6 hour discharge, or how it was back home for you?
Hello?
Hello?
Please, can you repeat the last where you said?
Yeah, I was just saying that the discharges, they can actually be of various kinds. Yeah, so if everything
Okay.
is normal in UK, the mother and the baby, they can be discharged as early as within 6 hours of after the birth. But sometime, depending upon that, if there was any other issues, then it can be delayed up to 24 hours for normal birth. And if it is a cesarean or something, then it usually is after the third day or so. So I was just checking with you that are you aware of the 6 hour discharge? Is this the normal practice at your place as well, or how was the discharge process over there?
Back home, it takes 24 hours for us to discharge them.
24 hours. Okay.
Yes, please.
Okay.
With
Yeah.
normal
So
delivery and cesarean section is 3 days.
yeah. So over here as well, as I said, that even 24 hours is not an unknown sort of thing, but there are discharges which happens at 6 hours as well. So, which is also fine if everything is normal, no issues at all. Then you can discharge them at 6 hours as well.
Okay.
Okay. So
Okay.
when we look at that, what is going to be the postnatal care? Then majority of the time, the postnatal care will depend upon the type of the birth, because the care is going to be different if everything has been normal, and if you have been discharged in 6 hours time, it is going to be a different type of care, because at that time that everything is absolutely fine, the baby is healthy, the mother is healthy, there are no complication, good family support is there, there are no any emotional psychological issues, and everything is quite healthy and going in the right track. So your postnatal care is going to be more of the care that, okay, to check that everything stays fine. And it is going to be more of that we are there if you require kind of a thing, rather than actually being too much hands-on on that one. But definitely, as soon as the delivery has happened, it is going to be very important to make sure that all the physiological observations, the meows chart is done, because before discharge, these are some of the things that you'll need to be absolutely sure that the mother's observations, they are normal, and there is no complication over there. Also, we will need to complete the sepsis screening chart as well. Even in the postnatal care, the sepsis screening chart will need to be done, so as that you again rule out that there is no risk of maternal sepsis. There are no red flag or orange flag signs which are there. And in case if it is there, then of course you are going to be dealing with them. Yeah. So if both of them, they are, you have completed the meows, you have completed the sepsis screening, and if it is fine, well and good. But if it requires, the escalation is required, then you are going to be escalating that one. And
Okay.
of course, the care plan, we depending upon that, if there is any escalations or anything that is required, or any postnatal care, as we already know that the care plan is going to be done by the SBAR technique. And we can decide the care plan can be for up to those 6 hours if you are deciding to discharge the patient in 6 hours time, or it can be the 24 hours care plan if you are deciding to discharge patient the next day, or if it is a cesarean, then according to that one. So the care plan will depend upon all those things, but the format of the care plan is going to be like the SPAR technique.
Okay.
This we have already gone through the sepsis screening. So are you okay with this one? Do you want me to explain anything in this one again?
Actually, this one is my first time of seeing this the septic 6 community setting. So, yeah, if you can go over because I'm not
Okay,
familiar
that's
with
fine.
this
We'll go
one.
through. It's no problem at all. We can go through this one. So basically, this is the sepsis is, as you know, that this is one of the most important thing that we would want to rule out. So, and sepsis, we know that it is any kind of severe infection that can lead to an emergency situation, or a multi-organ failure, and all that can happen. So the infection can spread throughout the body. So that basically is what the sepsis is, that severe infection. And we want to rule out that there should be no risk of sepsis. And this being like delivery, whether it is a normal or whether it is any intervention that has happened, it is something where there is always a chance that there can be some kind of infection that can happen. That's the reason it is very important that we do the screening so that we rule it out or we catch it early on if there is any risk. So this is the screening tool that we use to see that whether there is any risk of sepsis, and if there is the risk, then what is the risk, and then how to act upon that one, what to do. Yeah.
Okay.
So you can see that over here on this side that you will see that there is the patient details. So normally a label is going to be fixed over there. And this is the staff or that whoever is completing this form, their detail. So you will need to write the date, the name of the person who is completing this form, their designation, and the signature. Then we will need to see, because this is the sepsis, this tool is used at various stages and various wards of the hospital. So it also says that is the end of life pathway in place. So if we are using it in the different wards, then we can do that one as well. Is escalation clinically appropriate? Then and if we have to just sign this one. So if we have put like the end of life thing is there, or there is a do not resuscitation or something like that is there, and then we can put the thing that we have to discontinue using this chart. But there is nothing like that is over here, so you don't need to complete this one. You'll need to come on the next section, which is there, that does the patient look sick? So now, or if the news or the meows over here that has triggered some, that the score is high, which suggests that the patient is sick. So what you will need to do is that, since in your case it is going to be a mannequin, you will need to ask your examiner, that examiner, please can you confirm if my patient is looking sick or not? Now, if the examiner says that your patient is not sick, yeah, then what you have to see it has two arrows which come out of it. One is Y, which says yes, and one is N, which says no. So if your examiner says no, then this is the box that you will need to check, that you can say that there is a low risk of sepsis and that you are going to just using the standard protocol of care, and you will consider the discharge with safety netting. So whatever discharge is there, like whether it is a 6-hour discharge or whether it is a 24-hour discharge, that you are going to be going ahead with the normal protocols and the normal discharge process of the patient, and that there is a very low risk of sepsis. So if this first questions, the answer is no, then the rest of the things, they become irrelevant. Yeah, because it has just finished over here itself. Have you understood it till now?
Yes. So,
Yeah.
doctor, if I understand, because with this topic, I have issues on it because so if I understand you perfectly, you are going to
Mhm.
be given the sheet you are using to teach me. You are going to give it. So you are going to use that sheet to ask the patient questions. So when you when you ask the patient, then you like when you ask the patient the question, then you use what is on the sheet to follow what you can do for the patient. Or
Yeah.
I don't know whether I'm
Yes.
right or
No, you are right. You will be given the sheet. Yeah, and you
okay.
have to follow. So you don't have to mug up anything. You will be given the sheet. Yeah, and you have to follow the sheet, and you have to do according to how your the cascade happens. That is why I was saying that your very first question is going to be that does the patient look sick? Now, in the exam, because it's a mannequin, you can't really say that whether the patient is looking sick or not. Yeah, so you will have to ask the examiner that the examiner, is my patient looking sick? In real life, of course, you can look at the patient and you can tell that whether someone is looking sick or they're not looking sick.
Okay.
Yeah. So if your patient is, or if the examiner says that the patient is not sick, and if the observations that you have taken, your meow score, that has come as normal, then you know that there is no risk of sepsis or there is a very low risk of sepsis. Yeah, because the patient is also fine, the observations are also fine, then why should you be worried about any kind of infection? Yeah. So if the answer to them is no, that no, your patient is not looking sick, then you just follow this one, that there is very low risk of sepsis. You are going to just carry on using the standard protocols of discharging, and you are just going to safety net. Now, do you understand what is safety netting?
Hello?
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 Mercy, can you hear me?
Yeah, the line.
Are you having any issue?
Okay. Yeah. Now I can hear you.
Okay. So do you understand what the word safety netting means?
Safety.
Net. See, this one,
No.
this bit over here.
Let me see. No, please.
Okay. So I'll explain. So what is safety net? So safety net is something that you will tell the patient what to look out for and when to get help. So say
Okay.
for example, you are discharging the patient. Yeah. So when you discharge the mother, you will say that, okay, I'm not expecting anything to go wrong, but please look after the perineal side. Yeah, so you have got episiotomy. So look after the stitches. If you feel that the stitches are looking red, or if you start getting pain, or if you are getting any smelly discharge over there, or if you start getting any fever, yeah, then those can be the signs of infection, and you will need to come and see us, or you will need to contact us. Yeah, or you need to go and see your GP with regards to that. So that
Okay.
is what is called as safety netting. Yeah, so that we have done the safety netting by telling the patient what to look out for, what is abnormal, so and when to get help. So that even I am discharging the patient, even though I'm discharging them, but I'm still telling them that in case if things are not looking right, then you need to come back and contact us, or you need to go and see your GP, or you need to contact the community midwife. Do you understand it now?
Yeah, I'll read it over, but yeah, it's okay. You
Okay,
let's
no, I'm happy
continue.
to, yeah, I'm happy to explain it further if you have not understood it.
I'm okay. I'm okay. I'll
Okay,
read it when the class is over. I'll read the recording again, and maybe
okay,
I'll
okay,
appreciate
that's
what
fine.
you are saying.
Okay, so say if there is no, then you are going to be using this one. But if the answer to your first question, that does the patient look sick, if the answer to that is yes, yeah, then you are going to be thinking, or you have to answer one of these ones, that is there a possibility of an infection? Yeah. So, and if you think that there is a possibility of infection because the patient is not looking well, then you have to look that is there a source of infection? Like, for example, is the patient having cough, cold, or pneumonia-like symptoms? If there is a urinary tract infection, possibility of that one. Is there any abdominal pain or abdominal distension which is there? You need to also look out for any skin infection like cellulitis, or if there is any arthritis, septic arthritis, or if there is an infected wound which is there. Device related infection that you have to see that is there any the IV cannula in which might be causing the infection. Is there any urinary catheter in which might be causing the infection? Is there any central line or anything which is there which might be causing the infection? And you also will need to look at that whether there is any possibility of meningitis, or if there is any other reason that why there can be a infection. So if the answer to this question, does the patient look sick? If the answer to that is yes, then you need to look out for the infection and any source of infection. Okay. So if you can see that there is a source of infection, yeah, then you go on to the next step. But if there is no source of infection, then it is possible that the patient can just look a little bit sick because they have just gone through the labor and delivery and they are just tired, and that is the reason that they are looking a little bit sick and unwell. And that is why if there is no source of infection, if you know for sure that there is no infection which is there, then you can again go back to that low risk of sepsis. You can follow that one and you can still go ahead and discharge the patient. Have you understood this point?
Yes, please.
Okay, fine then. So if the answer to your infection was yes, that yes, you found that there is some infection and there is a source of infection, then you have to look for the red flag signs. Now, even if there is a one red flag, then you have to follow the sepsis pathway. And the red flags can be that maybe the AVPU score is less. The patient is either patient is not alert, they are only responding to voice pain, or they are unresponsive. They are very confused. If the blood pressure is less than, the systolic blood pressure is less than 90, heart rate is more than 130, respiratory rate is more than 25, oxygen saturations is less than 92%. If they are having any non-blanching rash, they are looking very cyanotic or mottled appearance. If they've not passed urine in the last 18 hours, or if the lactate is is more than 2 millimoles, or if they've had a recent chemotherapy. So even one of these red flags, if it is present, then you are going to follow the sepsis 6 pathway. And I'll show you that what is the sepsis 6 pathway. But if the answer to this one is also no, that there is none of this which is present, then you will look at the amber sign criteria, that whether there are any amber signs which are there. And in the amber sign, it might be that either the relatives are a little bit concerned about the mental status, that although the patient is alert, but they don't seem to be fully aware of what is going on. It is possible that there is an acute deterioration of functional ability. They might be immunosuppressed. There might be a trauma or surgery in the last 6 weeks, sort of thing. Respiratory rate is between 21 to 24. Systolic blood pressure, although it is not as low as the red flag, but it is between 91 to 100. Heart rate is between 91 to 130. And they have not passed urine, or the temperature is more than 36, or if there is any signs of wound or any device or skin infection. So any of the amber criteria also, if there are there, then also you are going to make sure that you are at a very low threshold of following the sepsis 6 pathway. So any amber criteria, if there is a yes, you send the bloods, you get the urgent review from the senior. And if with that one, you will need to, as soon as you send the bloods, you will need to write the time, you will need to initial. And the review of the senior, you will need to write their time and the initials, because this is more for the medical legal purposes as well, that we need to show that how quickly we acted upon if there was any problem which was there. Yeah, so then if there is any of this, any problem which in the bloods and things, if there is any abnormality that is present, then you are going to follow the sepsis 6 pathway again. Yeah, and if there is nothing, all the bloods, they have come back as normal, then it is going to be the clinician who is going to decide that whether they need to prescribe any antibiotics, or whether they are happy to discharge the patient with the safety netting. So this is basically what the sepsis screening tool is there. So it's quite self-explanatory. So I think that, as you have said, that you can take some time to go through this one. Although I had shared this form on the group early on when we started the group. So you can have a look. I've already shared that one. Okay, any question that you have, Mercy, in this one?
Yeah, okay. I'm okay for now.
Okay, so then as we said that if there is any proven sepsis which is there, and we are saying that you start the sepsis 6 pathway. So this is basically the sepsis 6 pathway. So what it means is that there are 6 steps that you will need to take if you are worried that there is a possibility of the sepsis. Now, this is a community one, but the hospital one is also similar. Instead of the GP, it is going to be the consultant or the doctor. So if it is in the community, then you can just do this one, that you are going to be discussing with the GP or the on-call clinician if there is the clinician over there, and you are going to be making them aware of the situation. So most likely the patient is going to be transferred to the hospital, because if there is a risk of sepsis, they will need to be looked after in the hospital and they can't stay in the community. So once they are in the hospital, give oxygen to make sure that the oxygen saturations are within normal limits. You are going to be obtaining the bloods, antibiotics, ensuring the hydration or fluid resuscitation, and you are going to be monitoring the vital signs which are there. And depending upon how the patient is progressing, you are going to move ahead. But these are the 6 steps: to call the doctor, to start the oxygen, get the bloods, give the antibiotic, make sure that there is adequate hydration, so IV fluids, and monitor the vital signs on a regular basis, so that you are able to see that what effect it is having. Is that clear? Mercy, are you okay with this one? Hello? Hello? Mercy, do you want me to move on? Is that clear, or any questions that you have in this?
Well, Doctor, yeah. Well, it's better, but I have to still read over. I have to read over.
Sorry? You are reading. There you go.
Hello?
Hello?
Yeah.
Yeah? So any question you
No,
have in this one, or shall we move on?
yeah. Let's move on. I think it's
Okay.
the same thing that you've explained to me, right?
Yeah.
All right, let's move on.
Yeah, but you can, as I said, that you can go through this one again. And if there is any question that you have, like, we can discuss it again. So this is not the only time that we are going to go through this. When you will come for the face-to-face training as well, we'll go through these charts again. Okay, but I have shared this on the group as well. So please read through it. Okay, so this is basically what your postnatal care is, that you are going to be making sure that you are checking the mother and the baby, and you are going to make sure that they are otherwise the observations are fine and there are no issues which are there. And after that, you will need to do the meows screening as well as the sepsis 6 screening. And if the sepsis tool and the meows chart is all fine, then the patient can be discharged. Yeah? And the rest of the care can be shifted to the community. Okay, so that completes the postnatal care. So we can go through the postnatal check as well, and then we can look at the criteria that what the criteria are. Okay, so do you Mercy, do you want me to or do you want to tell me that what is the difference that you think is between the postnatal care and postnatal check?
Yeah.
According to you, what is the difference between postnatal care and postnatal check?
All right. With the postnatal checks, what I know is that you are going to do head to toe assessment of the woman to know if
Yeah.
everything is fine, and also
Mm-hmm.
if there is any deviations from the checks that you are going to do, you are going to correct it, or you are going to um escalate to the senior midwife or maybe something.
Yeah.
And with the postnatal checks that we did, that one you are going to that one to is the same thing, but that one you are going to use the form. I'm yet to read over it because it's my first time. So that one, as you said, you are going to use the form to do your assessment. So upon the assessment asking if your patient is unwell, that will give you the clue that you are to do this or you are to do that. I don't know whether I'm right.
No, that's fine. See, I think that one thing which I can suggest, that when we are looking at the postnatal care and postnatal check, so it is almost as if that one is a little bit subjective and the other one is a more objective sort of thing. So when we
Okay.
are talking about the care is more of like subjective sort of thing. So you are trying to make sure that the mother is comfortable, the baby is comfortable, that they are you have made sure that mentally, physically they are well. Yeah. So they
Okay.
are looking well, they are otherwise well. You have cared for them in such a way that you're looking after whatever needs that they are having at the moment, and that there is no chance of them looking unwell or any sign, any risk of sepsis or any of abnormal findings. So that is basically what the care is, that you are providing that kind of a care as you are doing looking after kind of a thing. And then you are shifting the care to the community midwife if you are happy when you are discharging the patient. When we say postnatal check is the more objective sort of thing, that actually you are going through each and every system and you are checking both the mother as well as the baby before you are discharging them. Yeah, so those are going to be the health check kind of a thing that is performed to make sure that they are fine before you discharge. Now, the postnatal check happens twice. Once is that when you are discharging the mother and the baby from the hospital, and then there is a 6 weeks check that happens of the mother as well as the baby as well, where you are going to go through a more detailed check that is going to be there to see that within that 6 months, if there is, or 6 weeks, sorry, that if there is anything, any abnormal finding or any thing which has come up, which you were not able to notice just at birth. And then you are later on, it is finding for the baby. And for the mother, it is to make sure that her body has gone back to normal and that she has returned back to her day-to-day sort of activities, and all is going well. So these are basically the difference between the postnatal care and the postnatal check. Yeah? So this one, when we are looking at postnatal check, then we are going to, as I said, that we are going to have the health check of both the mother and the baby to make sure that the mother is recovering well from the birth and the baby is adjusting well to being a newborn. Yeah. So over here, the temperature, pulse, blood pressure will be checked during the stay, and depend upon the type of the birth, it is going to be decided that for how long they have to stay or when to discharge them. Yeah.
Okay.
Also, in the postnatal check, we are also going to make sure that the mother is happy to feed her baby, and if there are any breastfeeding related questions or the technique that you have to show the mother that whether she is okay to breastfeed. Yeah, and a
Okay.
detailed postnatal check is after 6 weeks. Yeah, because you at that time the body is still recovering. So at 6 weeks, the GP is going to do the check to say that yes, everything has gone back to normal. Okay.
Yes.
So if we have to do, then what is included in the postnatal check? So we have to check physical, mental, and social. These are the three aspects that we are going to be looking at more when we are doing the postnatal check. So physical aspect is going to be that any signs, your routine observation of temperature, blood pressure, pulse, etc. Then any signs of infection or pain, if it is there. And then you are also going to check about the lochia, perineal healing, any signs or symptoms of venous thromboembolism. Now, that is also a risk because yeah, after going through this birth and being a little bit more sedentary, there is always a risk of having a venous thromboembolism. So you have to rule these things out when you are doing the physical check. Then in mental check, you are going to be checking for the appetite, that there's a good appetite, energy levels are good, the mother is sleeping well, she is able to cope up with the daily living, her mood, anxiety, depression is, she's not suffering with any of those things, and she is otherwise happy and happy to look after herself and the baby. And then the social, where we are going to be checking with the family relationships and enough support that she's having at home, and also to see and involve that if there is the care plan that you make, that the family is also involved as a part of that one so that they can support. Then apart from these three, of course, the breastfeeding is going to be checked, and like any information that is required, either you give a verbal information and also the written sort of information about that, how to feed, what should be the position, what is the attachment, the responsive feeding, and what should be the intervals of feeding, if there is any any issues with breastfeeding, such as breast tenderness, engorgement, or any, if that is there, then pain management and all those things. And then to record all of these things, that you have done all these checks and everything before you have actually discharged the patient. Have you understood this? Any questions, Mercy, in this one?
Yes. No question. I'm okay.
Okay. So basically, this is, as I said that earlier as well, that these are like small topics. It is nothing, not a big thing in this one and too much to explain. So these basically are the two other stations, the postnatal check and the postnatal care. Yeah. So we'll quickly now go through their criteria as well, so that you can actually appreciate that what are they asking in the criteria, and what should we be looking in that one. Yeah, so let me just bring this one up. Okay. So this is the postnatal care marking criteria. So over here, as we said, that in the care that you are going to be calculating the meow score. So you will be given the meows chart. So you are going to be taking the temperature, pulse, blood pressure, all those things, and you are going to be completing that one. And you are also going to be completing the maternal sepsis screening tool, the one which I had already shown you. And that is the screening tool that we are going to be using, asking the patient that if she's well or unwell, and according to that, following that one. And using the meows chart and the sepsis chart, you are going to be making an accurate assessment of the woman's condition. So you will need to say that the mother is looking healthy and that there are no issues or no complications or cause of concern, and hence it is fine for the mother to be discharged. If there is any issues, then you are going to be escalating. And if you have to escalate, then you are going to be using, or if you are going to be giving this handover, then you are going to be using the S-bar tool to give the appropriate next steps of the care. And if you need to escalate, then you are going to be escalating into the appropriate staff grade. And verbally, your communication should be clear and it is appropriate. So in the exam, it is going to be like the scenario is going to be like a verbal as well as the written sort of scenario, both. So what you will need to do is that you will need to calculate the meow score. You will be given a meows chart because it is still going to be a mannequin. So you are going to be given all the readings. Based on the readings, you are going to calculate the meow score. And you are also going to complete your sepsis sort of chart. And then you are going to write down your S-bar sort of findings on that one, that, okay, what is the situation, background and all that, you will write them. And then verbally, you are going to tell the examiner that, okay, the meow score of my patient is so-and-so, the in maternal sepsis screening is negative and there is no risk of any sepsis. And since the mother and the baby are doing fine and there is no reason for me to escalate the care. And then you are going to say that, okay, this is that, and you are going to give the current assessment is basically this one, and you will give the recommendation that depending upon my my recommendation is that the mother should be going ahead with the routine protocols of discharge. And the community midwife will need to see her and need to assess her with regards to any issues related to settling back. And you will say about the safety netting as well, that any cause of concerns, she needs to get back to the GP or the community midwife or to the hospital, and make your communication clear. So it is kind of going to be the both sort of thing, that you will need to fill the forms and you will need to then verbally explain what you have done. Does that make sense?
Yes, please.
Yeah. Okay, so that is basically your postnatal care marking criteria. And then in the postnatal check, so this one, you are going to be, it is going to be more of where you will need to discuss the woman's mental health and well-being. So as we had discussed, that you are going to be considering the mental, the physical, and the social sort of aspects of this one. So this one is going to be the mental, where you are going to be checking that the woman is otherwise healthy, she's eating, drinking all right, her energy levels are good, sleeping is okay, she's able to cope up with the daily living, she's not having any low mood or anxiety, depression like thing, and her family relationships are fine. In physical health, you are going to check that there is no signs of infection, no pain, bladder bowel function are all right, the lochia is as normal depending upon the days, and the perineal healing has started and she's not having any issues over there. And of course, you will need to rule out the venous thromboembolism as well, and then discuss the infant feeding, that whether she's breastfeeding or bottle feeding, whether she's expressing the milk or whether she is having any other issues with breastfeeding, any tenderness, engorgement, as what we have discussed just recently. And then just to record all of the things that what you have gone through. And if there is any issues which are there, then you are going to be dealing with them, or your care is going to depend upon if there are any issues, and you give her the correct advice. And if there is anyone from the family who is there, and if you are happy and if she is happy to involve them in the care, then you plan the care accordingly as well. So that is basically going to be the assessment of your postnatal check. So again, this is also going to be quite a lot of a verbal station, because there is a mannequin again, there is going to be, and you will need to ask all these questions and then give all of the details about what is going to be your care from there onwards. Any questions on this one?
I have to read over it, and if there's any questions, I'll just post on the page.
Sorry, say again.
I said I have to
Sorry.
go over. Hello, please, can you hear me?
Yeah. Your voice was not very clear earlier. Now
What
I can hear you.
What I said is, like, I have to go over and know the things I'm supposed to do first. So in case of anything, now she's in the chair. Hello?
Yeah. Yes, I
So,
can hear you and I understand. Yeah. So I think that you're right, that you will need to just go through them, and if there are any questions, we can go through the questions then. But hopefully there should not be any issues in you understanding, because it's quite simple and straightforward things which are there.